Your labs reveal so much about what's going on with your health, but most of us don't have this experience when we go to the doctor's office. We know we're not feeling well and something is off, yet our doctor says that our labs look fine. What's really going on here? I'm going to share with you 10 of my favorite lab markers that tell the true story about what's really going on with your health. I am so excited for you to learn about your body. At the end of this video, you are going to know so much about what's going on with your health. And the last 5 markers are going to be less common ones that maybe you haven't had run yet. But I need to give the disclaimer that this is not medical advice. All of the examples I'm going to be giving of what could cause dysfunctions or irregularities in these markers and the ranges I'm giving, they're just generalizations. They totally might not apply to you. So learn from the video, but don't make medical decisions about your health because of what you learn in this video. So let's start with the 5 most common ones that you've probably already had drawn before. This is going to be broken into metabolic markers and nutrient markers. The metabolic markers are lipids and insulin. From the lipid panel, we have your cholesterol and then your triglycerides. I'm going to talk about cholesterol first. With cholesterol, you're going to see LDL, which is considered the bad cholesterol, HDL is the good, total cholesterol. But what you might not know is that the most meaningful marker from this panel is actually the total cholesterol to HDL ratio. This ratio has a 2 to 4 times greater predictive risk of cardiovascular disease and other diseases of aging. If you have a slightly elevated LDL, which is usually considered above 100, it might not actually be too concerning if you have enough HDL to balance it out. A total cholesterol to HDL ratio below 3.4 is considered ideal. Your lipid panel also has triglycerides as a marker. Triglycerides are what your liver makes, usually as a response to the amount of carbohydrates that you're consuming. Caveat being that the more burdened your liver already is, this could be because of alcohol or toxins coming from bacteria in your gut, the higher rate of triglyceride production there's going to be. So it's not always due to the carbohydrate consumption, but it's a pretty good marker of how many carbohydrates you're eating and is your body able to utilize them. When you can't actually burn them for energy or store them on your muscles, your liver is going to turn those carbs into fat, and that fat is called triglycerides. Might not have ever known that. If your triglycerides are above 100, you might be eating more carbs than your body can actually use. You might benefit from actually reducing your carbohydrate intake. That's been shown to be very helpful to lower triglycerides, as well as therapies that improve your liver health, like stopping drinking alcohol or reducing inflammation. The second metabolic marker is insulin. If you have had any type of blood sugar issues, you've had this run before, but if you haven't, you might not have ever had this on your labs. Insulin is so much better than the other 2 markers that are used to track our blood sugar, which are glucose. You'll find this on your comprehensive metabolic panel, also called CMP, or hemoglobin A1C. Whew, there's a lot of big science words here. Try to stick with me through it. The glucose and the A1C are going to either be a 1-day snapshot or a 3-month snapshot of what your blood sugar control looks like. But the thing is that over a long period of time, insulin is slowly rising to keep your blood sugar normal. So you might be having all of this insulin resistance where you're not having optimal blood sugar control and usage, and yet your blood sugar looks normal because insulin is getting produced in higher and higher amounts to take sugar out of your bloodstream. And where does it put it? In your fat cells. If you're trying to see, hey, what is going on with my body that's causing me to gain weight or to over-respond to carbohydrates with having weight gain or having blood sugar fluctuations, maybe even anxiety or fatigue, especially after meals, it could be because you're insulin resistant and you're not handling blood sugar well. But you, again, won't see that on the 2 most common markers that are being run in a lab. We really want to check insulin, and optimal I would say is below 10. There's some functional medicine doctors that give a very narrow range of 3 to 5. But really, you're gonna feel pretty good if your insulin is below 10. Above that, you might be starting to develop some insulin resistance. The remaining markers in the common category are all nutrient markers. I would say that the most important one is vitamin D. Vitamin D is actually a hormone. I don't know if you knew that, in addition to being a vitamin. And vitamin D is super powerful at reducing inflammation. It also helps to improve cardiovascular health, bone health, it's super important for that, and many other things. We can tell that someone's gonna have a higher risk of all of the pro-inflammatory conditions if they have a low vitamin D, and you're gonna see usually more joint pain, more depression or lower mood, worse hormone health of the other hormones. We wanna make sure that vitamin D is between 50 and 100. And some research says that for bone health, you really wanna aim for about the 70s. You're usually not gonna see any further increase in your health once you make it over the 70s into the 80s and 90s. The second nutrient marker is vitamin B12. This one is most known as being a vitamin that causes fatigue. You might have had a B12 shot or injection before so that you can have more energy. B12 is really important for your neurological system. It's important for being able to have healthy nerves and healthy neurotransmitters that keeps you having a good mood. And you might notice that if your B12 is below 800, that you don't have all the energy that you really could have. But it's not actually deficient to where it can negatively impact your nerves until it's below 400. But most labs are gonna use a really, really low range, usually around 250. You might be showing up as normal by being in that 250 to 400 range, and yet you could be at risk of your nerves not functioning as they're supposed to. Sometimes people ask, can I get too much B12? Because you can get it in mega doses in supplements or through the injection. And there's really not solid research to answer this question. But I would say that we want to keep it below the 2000 range. After 2000, it's unable to be measured, so you don't really know how high it is. And there's just no studies showing a benefit of having a B12 of 1200 versus 2000. So we try to usually keep it around the 800 to 1200 range for our patients. One of the most misunderstood markers in this whole commonly run category is an iron panel. You might have an iron panel on your labs that just includes iron, TIBC or UIBC, and the percent saturation. But just like glucose, the blood sugar marker that can just fluctuate day to day, iron is the same way. It can swing 50 to 100 points in a week. So running in a one-time iron doesn't give you a great sense of where your iron's actually at. What we need to make sure is run is the ferritin. This is storage iron. And studies show that a ferritin below 50 can start to cause fatigue and hair loss. And yet most labs are going to use a lower range of like 15 to 25 as considered normal. When we see someone in that in-between where they're normal on their labs, but we know that they're not optimal, we're trying to help them to get more iron from their diet so they can have more energy, more stamina during your workouts, and to make sure it's not contributing to hair loss. One last thing to pay attention to is if you are a woman and you're still menstruating, don't have your iron run during your period. You're losing a lot of iron during that time because we're losing blood. Your labs might not look right if you have them done during that time, or for anyone, if you have them done after eating a meal or taking a supplement with iron. If we want to see your true levels, you need to have it done fasting in the morning without having iron supplementation within the last 12 hours and not while on your period. Now let's go into some of the less common lab markers that you probably haven't had drawn before. I'm going to break this up into inflammatory markers and thyroid hormone markers. And I know you might be saying, oh, I've had my thyroid drawn, but what I'm going to share with you is probably different than what you've actually had done. But first, let's talk about the inflammatory markers. First up is one of my all-time favorite markers. That is hsCRP, high sensitivity C-reactive protein. This is a general marker of inflammation. Oftentimes, when you have inflammation anywhere in your body, we're going to see this marker not in the optimal range. It especially is related to inflammation that comes from the gut. That could be because of the foods that you're eating or what's living and growing in your gut. And doctors, if they do run this, tend not to run the high sensitivity version. They run this old school version that is not used in studies over the last few decades, that is not really able to pick up on most people's level of inflammation. It has to be like a raging fire within the body to show up on the lab test. If you're going to get CRP run, just make sure that it is the high sensitivity one. And then we can tell what your inflammation is, because 1 to 3 is considered borderline and above 3 is high. So in our patients, we always want to see their hs-CRP below 1. An even less common marker that's also related to inflammation is homocysteine. Homocysteine is a marker that your body naturally produces, but it needs to get detoxified. And when it's not detoxified, it just hangs out in your blood and causes inflammation all over your body. This is why it's associated with cardiovascular disease, because it can cause inflammation in your arteries, and then that can lead to plaque buildup. Homocysteine is also a marker related to our hormone detoxification, because the same thing that helps to break down homocysteine is also helping to break down some of your hormones. If this marker is high, it might not just mean you have some inflammation or cardiovascular issues, but it could also be related to you having hormonal dysfunction. Another separate way to measure inflammation is through GGT. GGT is actually a liver marker that is related to our antioxidant status. We all know that antioxidants are really healthy for us and they help to prevent aging. If you want to learn more about that, I have a video for you. But this can mean that if your GGT is high, that your antioxidants are actually low. Or another way of saying it is that your pro-oxidants are high. And when we are pro-oxidizing, we are inflaming our bodies, we are aging, we're damaging the body. Therefore, we want to keep GGT as low as possible. And studies show that once your GGT starts to go into the double digits, if you're a female, or the teens and above if you're a male, that you start having an increased risk of pretty much all of the diseases of aging and of overall mortality. This is such a good, easy snapshot to see how fast is your body aging due to inflammation or low antioxidants. The last marker of inflammation that I'm going to check with someone is omegas. So omega-6 is more of a pro-inflammatory nutrient. This is something that your body does need in order to survive. We need to have some inflammation. Otherwise, if you bumped your elbow, it would never heal and recover. Or if you got sick, you would just die. And then we have omega-3, which is an anti-inflammatory. And these need to be properly balanced, just like our cholesterol. If your omega-6s are too high, your omega-3s are too low, then you start inflammation and it doesn't resolve. You have nothing there to calm it back down and to balance it out. A high omega-6 to omega-3 ratio, or just low omega-3s, are associated with all the diseases of aging. That includes dementia, cardiovascular disease, depression, and low mood, joint pain, arthritis, could keep going. We want to make sure that we do have enough omega-3s to resolve any inflammation. So we're going to look at having an omega-3 index that is between 8 and 12%, even though some of the labs might say anything above 5.5 is okay. We're almost there. The last marker that's not as common are your thyroid hormones. You might have had TSH run. TSH is actually coming from your brain. It's not even directly a thyroid marker. And it assumes that you have a very healthy brain and a very healthy feedback loop that says that if you don't have enough thyroid hormone, your TSH will start to rise. And this is called hypothyroidism. So if you have a normal TSH, then doctors say everything looks good. But if you have any symptoms of hypothyroidism, this could be trouble losing weight, having cold or dry skin, having constipation or slow bowel movements, having hair loss, fatigue, brain fog, then we want to actually see what your thyroid looks like. This means running free T3 and free T4. Free T4 is your storage thyroid hormone. This is what your thyroid makes as a response to the TSH coming from the brain. T4 then goes throughout the body when it says, okay, let's turn on your cell and have metabolism and energy and make things. It's going to turn into free T3. And then T3 goes in, turns on the lights and all of your cells and the factories start working and doing things for your body. A free T4 that is above 1 usually means that your thyroid is functioning well. And a free T3 that is 3 to 4 is optimal. You may or may not have symptoms when it's 2.6 to 2.9. But 2.5 and below is what I like to call the zombie zone. Because it can feel like you are just willpowering your way through the whole day because your body just kind of wants to shut down. If your brain is inflamed, or you're depressed, or you're sleep deprived, you're on antidepressants, your brain might not be as responsive to having low thyroid hormone. It could also be that your brain wants you to have a slow metabolism. Maybe you've been calorie restricting for too long, or you've been chronically ill, and your brain says, we need to go into hibernation mode and slow everything in the body down. Then your TSH will be normal, but you won't really have enough thyroid hormone or normal thyroid hormone. The only way to tell this is that we actually check and run your thyroid hormones. And there you have it. Now, I do want you to remember that you can not feel well, and yet your labs, even these ones I mentioned, can all be in the normal range or even optimal. And likewise, you could feel well and yet have a lot of abnormalities with these lab markers that we just discussed. And that is because labs do not tell the whole story. We never treat a lab. We treat you. You are much more than what we can find on these biomarkers on a piece of paper. When we sit down and work with a patient, we're looking at their history from birth to now, everything that they've been exposed to that could cause their body to dysfunction. We're looking at their lifestyle, their sleep, stress, exercise, diet. We're looking at their gut health. We're looking at their symptoms. Labs are then also added to that picture, and then everything's put together to figure out what's happening with you. So please be sure not to get stuck in that trap of, oh no, this is my lab. If this doesn't get better, then I'll never get better. Or this one thing is my root cause of why I have all the issues that I have. You now know more than most people about how to evaluate your health. Good job. If you enjoyed this video, please like, subscribe, and hit the notifications bell, and we'll talk soon.